into facilitator and barriers. And later it will undergo a second degree of analyzing using content analysis approach to identify common themes. There are the main three themes identified are hope, information accuracy and transparency, and also availability of multiple brands of COVID-19 vaccine in Malaysia. The main facilitator is hope. Many believe that the vaccine can keep alive and stop the spread of COVID-19 vaccine, and life will soon be back to normal. However, the barriers are about the information accuracy and transparency. People are worried about the safety profile, they're worried about the halal issue, there are also special patient groups that are not being addressed. The multiple brands are welcomed by the Malaysian, however, it also created a unnecessary, so this should be addressed before it roll out.
Good morning, everyone. My name is Mary Marley, and I've recently completed my technology in Sydney. The research conducted as part of my PhD related to the education, training, and assessment requirements of community pharmacy staff associated with the provision and delivery of minor ailment services. Minor ailment services are a structured community pharmacy-based healthcare service that encourages individuals to manage their own minor ailments using a number of self-care.
Hello, my name is Jim. I'm from School of Pharmacy, University of Nottingham, Malaysia. I present you my research on the perception of COVID-19 vaccine by the Malaysian public. This is a social media qualitative research using ethnography approach. March 2020, WHO announced COVID-19 as the pandemic. A year later, in February 2021, Malaysians start receiving COVID-19 vaccine from Pfizer, Sinovac from China, and 2 months later, also the COVID-19 vaccine from AstraZeneca. However, on the 14th of April 2021, Malaysian official announced that the uptake of this vaccination rate was very slow. Many Malaysians are taking the wait-and-see approach as reported in the local research. My research aimed to identify the barriers and facilitator for COVID-19 vaccine in Malaysia. Posts about COVID-19 vaccines and also the associated comments were manually extracted from this KKM, Ministry of Health website on Facebook. And these harvested comments first will undergo a first degree of categorization into facilitator and barriers. And later it will undergo a second degree of analyzing using content analysis approach to identify common themes. There are the main three themes identified are hope, information accuracy and transparency, and also availability of multiple brands of COVID-19 vaccine in Malaysia. The main facilitator is hope. Many believe that the vaccine can save people's lives and stop the spread of COVID-19 vaccine, and life will soon be back to normal. However, the barriers are about the information accuracy and transparency. People are worried about the safety profile, they're worried about the halal issue, there are also special patient groups that are not being addressed. The multiple brands are welcomed by the Malaysian, however, it's also created a unnecessary worry. So this should be addressed before it roll out. People are worried about the safety profile, they're worried about the halal issue.
Good morning, everyone. My name is Mariam Ali, and I've recently completed my PhD at the University of Technology in Sydney. The research I conducted as part of my PhD related to the education, training and assessment requirements of community pharmacy staff associated with the provision and delivery of minor ailment services. Minor ailment services are a structured community pharmacy-based healthcare service that encourages individuals to manage their own minor ailments using a number of self-care strategies. Minor ailment services exist in a number of countries, including the UK, but do not currently exist in Australia. These services are led by community pharmacists, however non-pharmacist assistants play a critical role and support role in service delivery. The research my team and I conducted intended to determine consensus about the suitability, appropriateness and content of the current training, education and assessment requirements of community pharmacy staff involved in the provision and delivery of these services. Largely, we wanted to understand what stakeholders' needs were and the most effective training and education to deliver to them. In order to conduct this research, we conducted a modified Delphi process using 2 phases of online questionnaires and 3 rounds of teleconferences. We included a range of stakeholder participants in the study, including pharmacists, non-pharmacist staff and professional organisation representatives across all Australian states and territories. A number of key findings were made from the research. Firstly, stakeholder participants felt that it was essential that staff receive training regarding the clinical and the non-clinical aspects of the service. They needed to understand what their scope of practice was and discuss their limitations in terms of the clinical care, treatment and management of minor ailments. Additionally, participants reported that clinical assessments, diagnosis and treatment needed to be delivered by pharmacists only.
Hi, I'm Isabel, and I'm sure you have found many questionnaires for pharmacy practice in literature with the mention validated. However, validation methods differ widely. We have developed a self-report questionnaire to detect non-adherent behavior and used it to define the main validation steps, including the statistical tests. Sabine looked in the literature and came up with the following requirements. We need to test the validity, which says if the instrument measures what it is intended to measure, and the reliability, which says if the instrument produces the same results when repeated under the same circumstances. The phase validation tells if the instrument is easy to understand. The rate of patients missing answers, for example, is one indicator. The content validation tells if the items are clear and relevant. The statements of experts, such as pharmacists, are used to calculate the content validation index CVI. The construct validation tells if the instrument measures, in our case, medication adherence. We need another adherence measurement method and compare both results with Spearman's correlation. The internal consistency determines how interrelated the items are. It is calculated with Cronbach's alpha and a Varimax rotation. Finally, the test-retest reliability analyzes if the same answers are obtained at 2 different times. Patients' answers are compared with Spearman's correlation. This looks straightforward because we made statistical choices. We selected bivariate correlations because the results are independent of other variables. But more importantly, we recommend careful interpretation of the results because factors such as the use of small dataset bring the risk of occasional false significance. Thank you for your attention.
There are various terms for services provided in the pharmacy literature, such as pharmacy-led services, professional pharmacy services, cognitive pharmacy services, or medication management services. With a unique definition for services provided in the pharmacy, the evolution of the profession could be monitored and the comparison between countries could be facilitated. So our aim was to establish an internationally recognized definition for services provided in community pharmacies. We chose a three-step procedure. In a first step, 11 pharmacists collated a definition from published definition during a World Café-like workshop at the Pharmaceutical Care Network Europe conference in Portugal. Then we conducted a first Delphi round, sending a survey of the definition draft to all 164 PCNE members. Suggestions for improvement and comments were taken into account, and we conducted a second Delphi round, providing a new proposal. In total, 91 pharmacists answered the survey in the first Delphi round. In the first round, only a moderate consensus could be reached. For the second Delphi round, 50 members completed the survey and a consensus of over 70% was reached for the definition, which is: a pharmaceutical care service is any activity provided to individuals, e.g. patients or healthcare professionals, that is characterized by evidence-based standards and addresses patients' needs and preferences. The term pharmaceutical care services reached a moderate consensus of 54%. We were able to enroll pharmacists from Europe and Australia. Specific terms and definition exist already in many countries. This might explain the moderate consensus of the term. We kindly invite you to comment on the definition and the term by scanning the QR code. Thank you very much for your attention.
Muslims are a growing community in European countries, and Portugal is no exception. Traditional Arabic and Islamic medicine is presented in Figure 1. The main goal of this study was to describe Muslims' general health and medication-related practices, and possible implications for culturally competent community pharmacy practice. The study followed a descriptive cross-sectional exploratory design. The survey was self-administered to a convenient quota sample of 100 participants at Lisbon Central Mosque. 46 of the participants believed in the role of prophetic medicine and spiritual healing. The fulfillment of dietary options and Quran restrictions were observed by at least 62 participants, mainly to help prevent disease. Issues from pairing religious obligations with conventional medical treatments were assumed by participants, particularly those reporting a health condition who were significantly associated with traditional medicine. Since most of the sample observed compliance with traditional medicine, including the religious mandates, community pharmacists in Portugal should be prepared to accept the firm belief in spiritual component of treatments in the healing process. Complying with religious fasting and forbidden substances such as gelatin and alcohol suggest medication adherence issues, mainly some oral dosage forms with no alternative halal pharmaceuticals. In conclusion, the Islamic faith does not pose a substantial burden to Portuguese community pharmacy practice. Nevertheless, the believed synergy between prophetic and conventional medicines should be respected, with great attention to medication non-adherence associated with medicine's composition and fasting. Medication non-adherence associated with medicine's composition and fasting.
Hello everyone, my name is Tasikan. On behalf of my co-author, I would like to present the study titled Perioperative Bridging Anticoagulation in Patients Receiving Oral Anticoagulants. As we all know, there are limited evidence and recommendations regarding management of oral anticoagulation perioperatively. So, we perform a retrospective analysis to examine the bridging patterns of the patients who received oral anticoagulant from January 2017 to July 2019. We enrolled a total of 106 patients receiving oral anticoagulant. 92% of this being on warfarin and 8% being on non-vitamin K antagonist oral anticoagulant. Regarding on the indication, half of the patients are on anticoagulant for atrial fibrillation. The outcomes of the study include the bleeding and thromboembolic event. The graph on the top right shows the various patterns of perioperative bridging during oral anticoagulant interruption. The most common one was the pre- and post-operative bridging with heparin. We observed no thromboembolic event, and bleeding complication was observed by 10%. Bridging with heparin post-operatively associated with higher risk of bleeding, 16% versus 2%, statistically significant. So for the conclusion, we observe variation of patterns in perioperative bridging during oral anticoagulant interruption. There was no thromboembolic event observed, and heparin was associated with increased risk of bleeding when you bridging in this group of patients.
Hello everyone, my name is Suparachan Prasad. Today I'm glad to present our work on the title of Severe Hypoglycemia Related Emergency Department Visit in Type 2 Diabetes Patients Treated with Insulin at King Chulalongkorn Memorial Hospital, Thailand. As we know, severe hypoglycemia is associated with high mortality rate in type 2 diabetes patients, especially who treat with insulin. But the incidence and the causes in Thai patients are limited, so we conducted this study. All type 2 diabetes patients treated with insulin who develop at least one episode of severe hypoglycemia and receive 50% dextrose solution at emergency department during January to December 2021 were included. We reviewed the patient data and the details of the event retrospectively from electronic medical record to find out the causes. Of 4,195 patients, 62 severe hypoglycemia events were observed. The median age of this patient was 75, being male and female 50-50. At the pie chart, the major cause of severe hypoglycemia were poor intake 36%, skipping a meal 26%, diarrhea and vomiting 11%. Interestingly, we found that this cause may result from some situation, such as diarrhea from chemotherapy, or they skip the meal because of waiting for but exam was too long. So when we know the exact cause, we can improve their self-care knowledge to deal with the situation like this. In the conclusion, severe hypoglycemia rate in this study was 14.8 per 1,000 patient year, and continuation on the same dose of insulin during the sick day and non-compliance were the main cause that need to be addressed to reduce the hypoglycemia rate. Thank you for your attention. สวัสดีค่ะ
Hi, my name is Catherine, and today I'll be presenting on my research project titled Conversations about Cannabis, the Supply Process. The supply of medicinal cannabis is a topic of rising global interest for the management of a range of health conditions. And this is evident in Australia with many recent legislative changes to authorize its supply. However, very little is known from those involved in the supply process and who are affected by these legislative changes. Therefore, our study aimed to investigate key stakeholders' perspectives on the supply of medicinal cannabis in Australia to patients. Our study recruited medicinal cannabis stakeholders through purposive and snowball sampling. We conducted semi-structured interviews with 13 stakeholders individually. This was followed by a focus group with 8 stakeholders to critically appraise our interview findings. Afterwards, we organized the interview and focus group findings into codes and then themes for data analysis. 2 major themes emerged from the data analysis. 1, the supply chain pathway is complex and time-consuming. Stakeholders believe that the lengthy time for the approval of licenses to permit domestic cultivation and manufacturing contributed to this. Supply is also complicated by the bureaucratic processes relating to the prescribing and dispensing of products that are not registered with Australia's Therapeutic Goods Administration. The second theme that emerged was supply lines adversely affect healthcare professional practice. Stakeholders' views regarding the evidence base for medicinal cannabis and the lack of systematic guidelines for practice in some cases acted as a deterrent to participating in product supply. Our study showed that Australia's supply process of medicinal cannabis is complex and underdeveloped. These insights might assist other jurisdictions in developing policy around medicinal cannabis supply. Policy around medicinal cannabis supply.
Good afternoon. This study is about online teaching smoking cessation to the fourth-year pharmacy student during the COVID-19 pandemic. The participants were about 120 fourth-year pharmacy students at Chiang Mai University. This is how we teach students about smoking cessation. We divided the teaching into 3 components: the lecture, talk to a smoker, and practice. And we use Zoom applications for our online teaching. For the lecture, we have 3 hours to cover smoking cessation counseling technique, including the pharmacotherapy of drug use for smoking cessation. And then students have homework to talk to a smoker. And then for the practice, we have a small group of students, about 30 students for each class. And we have many activities, starting from watching video demonstrations of how to provide smoking cessation to a smoker. And then students will do role play of smoking cessation counseling with their friends. And then the students were divided into 3 groups, so that's about 10 students each group. to go to 3 stations, starting from the first one, chewing nicotine gum on their own, and the second station was role play with a simulated smoker, and the last station was sharing with their friends their experience talking to a smoker. At the end, we discussed with all students about the teaching, and we asked them to evaluate satisfaction for the teaching. And you can see the result that the students were very satisfied with our teaching, except for the video session that had the lowest score. So in conclusion, this is the first time of this online smoking cessation education that we offer to pharmacy students, and the students were very satisfied. Thank you very much. This study is about smartphone behaviors and addiction among pharmacy students in northern Thailand. This cross-sectional study aimed to evaluate the behaviors and adapted to smartphone among pharmacy students Smartphone in this study we mean both smartphone and tablet. We use an online questionnaire to ask pharmacy students. About 280 students responded to our questionnaire, and about 70% were women. They were from year 1 to year 5. For their smartphone use behaviors, the average time is about 7.5 hours per day for Monday to Friday. But for weekend, the time increased to about 8 hours per day. The top two reason to use the smartphone was that 93% use it for social networking. Mostly they use Facebook and Instagram. And about 90% of students use smartphone for online education. And also about 90% use smartphone for their entertainment. And mostly they use YouTube. For smartphone addiction, we measure by using Thai smartphone addiction scale short version. It has 10 questions. This is the detail of the question. And the results show that 49% of pharmacy students they addicted to smartphone. So this is the end of the study. Thank you for your attention. This is the end of the study. Thank you for your attention.
Welcome to my poster presentation. My name is Edita Czepilewska and I'm delighted to present research focusing on the role of pharmacists in optimizing therapy among elderly patients with neurological conditions. As the population of elderly is growing in the world, also in Poland the number of elderly people is increasing. Aging is often associated with multiple comorbidities, such as neurological disorders, as well as polypharmacy, which increases the risk of drug-related problems. That is why we conduct research to identify and categorize drug-related problems in elderly patients with a particular focus on neurological drugs. And we also develop recommendations for therapy optimization. The research was performed among Polish patients aged 65 years and older with at least one neurological condition. The average age was 77.9 years and the average number of comorbidities was 5.5, including 1.6 neurological conditions. Each individual was taking on average 12.7 medications from 6 to 23, including 1.9 neurological drugs. Above 30% of identified drug-related problems were associated with the use of neurological drugs, and they were caused mainly by an inappropriate combination of drugs. Based on the findings, 370 recommendations were compiled, 116 concerned neurological issues. Considering that in the aging society the prevalence of drug-related problems increases, a uniform pharmaceutical care model for elderly patients with multiple comorbidities, including neurological conditions, would be useful. Thank you.
Nice to meet you here. My name is
Increases, a uniform
Nice to meet you here. My name is Annie Paisan Sirikun. Today, I would like to take this opportunity to talk to you about our projects, prevalent and associated factors of potentially inappropriate medications use or PIMS among older people. PIMS cause avoidable adverse drug events in older people. Our objective is to evaluate the prevalence of and factors related to PIMS in older Thai urban residents. Methods: a cross-sectional study involving 387 participants, whose first-time health screening took place at the Geriatric Excellence Center, King Chulalongkorn Memorial Hospital in Bangkok, between May and October 2019. Participants were interviewed and assayed for PIMS by clinical pharmacists. Results: the prevalence of PIMS used according to the STOP and Beers criteria was 22.5% and 27.6%. Multivariate analysis found that the following were significantly associated with PIMS. Okay, let's go to the next point, conclusions. The prevalence of PIMS used in older Thai urban residents seen at King Chulalongkorn Memorial Hospital in Bangkok was high. Polypharmacy, older age, orthostatic hypotension, risk of depression, and frequent intake of health products were significantly related to PIMS use. So the aims of the pharmaceutical care service to reduce polypharmacy should be implemented, resulting in increased safety for these populations. Thank you.
from Hacettepe University Faculty of Pharmacy. Dear participants, I am Bilge Sozan Şahne from Hacettepe University Faculty of Pharmacy, and I want to share our brief results from our study and interprofessional view of emotional intelligence, pharmacy and pharmacy technician student sample. We aim to determine the differences between pharmacy and pharmacy technician students' emotional intelligence score, and we conducted a survey. This survey contains the short form emotional intelligence scale and 9 questions prepared by us. 438 pharmacy students and 61 pharmacy technician students participated to this survey, and most of the participants thought that emotional intelligence is important in the field of community pharmacy. When the lowest and highest scores of the students participating in the survey were examined, it was found that the highest score was 160 and the lowest score was 97. And there are no significant differences between students' gender, grades, reading habits, and the number of individuals in the family in terms of their emotional intelligence scale scores. However, there are statistical differences between pharmacy and pharmacy technician students' scale scores, and pharmacy technician scale scores are higher than pharmacy students. Also, 3 factors were confirmed according to the original scale, and these factors are expression, regulation, and utilization of emotion. The results of the study show the key components of EI did not make a difference in the study sample. These key components are gender, reading habit, and number of individuals in the family. However, the difference between professional groups is remarkable, and this result reveals the necessity of carrying out future studies for development of patient safety-oriented cooperation during professional education and increasing the interprofessional interaction in terms of emotional intelligence. Thank you for listening. Dear participants, I am Bilge Sozan Şahne from Hacettepe University, and I want to share our Dear participants, I am Bilge Sozan Şahne from Hacettepe University, and I want to share our results from the study opinions of content producer pharmacists on ethical social media use. We aimed to evaluate the view of pharmacists who produced professional content via Instagram in Turkey, where there is no ethical framework for pharmacists' use of social media currently. And we conducted semi-structured interviews, and the transcriptions were analyzed thematically through Atlas TI. 7 content producer pharmacists participated to our study, and 6 of the participants were community pharmacists, and 1 of the pharmacists provides consultancy services on pharmacy-related issues. And all participants emphasized that they are expert in this field to produce reliable content on health. And as a result of the interviews, 3 teams emerged. And these teams were social media use in healthcare, ethical issues, and elements related to content production. All of the participants stated that social media contents on health practices raise awareness on various health-related issues besides its negative effects. However, there's no guideline in Turkey, and this situation affects the adequate use of social media by pharmacists, and which is limited by the laws in the country. And it was emphasized by the participants that it's great of importance to determine the framework for pharmacists in order to prevent unethical contents produced by unauthorized persons. And in addition, it's apparent that the awareness of pharmacists should be increased about posting ethically appropriate content in social media and its effects on public health. Thank you for listening. That the awareness of pharmacists should be increased about posting ethically appropriate content in social media. Dear participants of the 21st International Social Pharmacy Workshop, I'm Bilge Sozan Şahne from Hacettepe University, and I want to share our brief results from our study entitled as Examining the Opinions of Health-Related Mobile Phone Application Developers. In our study, we aim to reveal the experiences and evaluations of the health-related mobile phone application developers, and we conducted semi-structured interviews. In Turkey, 15 mobile health applications with the highest score from Google Play Store and App Store were accessed in terms of health, medicine, and pharmacy keywords. And 8 developers participated to our semi-structured interviews. The developers have different backgrounds ranging from physician to English teacher, including pharmacist, and their applications were about various contents like reminders of drug use, health and nutrition, etc. And as a result, 3 themes emerge, and these themes are application development reasons, development processes, and future of mobile health. Mobile health practices which bring an innovative approach to health service delivery are also important for pharmacy, and increasing awareness of pharmacists about the practices, which stated by the participants, will have even more important effects in future. And it's in this context, it's necessary for pharmacists to be involved in mobile health application development process. And application development related courses in pharmacy education curriculum and lifelong learning programs will contribute pharmacists having a good command of software developing skills. Also, it will be helpful for pharmacists to work with different professional groups like software engineer and physicians. Thank you for listening.
I am Associate Professor Marit Våset from the Arctic University of Norway, presenting the study Selective Serotonin Reuptake Inhibitors and Risk of Breast Cancer, the Norwegian Women and Cancer Study. Our aim was to investigate the potential association between use of SSRI and breast cancer, as previous reports were somewhat conflicting. We linked data on self-reported SSRI use from the Norwegian Women and Cancer Study, NOVAC, with data on breast cancer from the Cancer Registry of Norway. We included 74,879 participants without a previous cancer diagnosis and with complete information on SSRI use. 5% were SSRI users. The participants were 46 to 68 years old at baseline and were followed up from enrollment between 2003 and 2010 and until a cancer diagnosis, death, or the end of 2013. There were 78 cases, 2%, of incident breast cancer among users of SSRI, and 1,351 cases, 1.9%, among non-users, resulting in a non-significant hazard ratio of 1.04. The Cox proportional hazard regression analysis was adjusted for age, current use of hormonal contraceptives, current use of postmenopausal hormone therapy, maternal breast cancer, age at menarche, menopausal status, number of children, age at first birth, body mass index, alcohol consumption, and tobacco smoking. So, this large prospective record linkage study reports no significant association between self-reported SSRI use and breast cancer. The forthcoming paper will be updated with breast cancer diagnosis through 2018.